All right, welcome back to our Lunch and Learn at PROCare Physical Therapy. Dave Tranchita from PROCare Physical Therapy, CEO and physical therapist. Today we're going to be talking a little bit about TMJ dysfunction, or TMD. A lot of times what you see when you have symptoms is your jaw joints are tender to the touch. The muscles are tight around the jaw. You may be getting some headaches, could get ringing in the ear, could even have some neck problems. Usually what people do have is when they're chewing or eating or trying to open their mouth widely is they start having some clicking or popping in one or both jaw joints. This is becoming more and more an epidemic because a lot of us are sedentary, we work at computers, we have poor posture, and posture is one of the main issues that we are seeing and addressing to help improve their conditions. Some of the things that I wanted to show is because of the muscle and joint structures of the TMJ area, we have a muscle up in the skull called the temporalis. Again, that can be a headache generator. You can kind of see it's already in the head. It attaches into the jaw joint. You have the masseter muscle. Again, those can get tight from doing a lot of repetitive chewing. This is one of the strongest muscles in the body, and it can develop what's called trigger points or nodules in the muscle, and it causes some fatigue and of course some pain. The jaw joint per se is a hinge joint similar to the ball and socket joint in our shoulder or in our elbows or in our knees. And what happens is you have a disc in the joint that actually starts getting hypermobile, gets loose, and it starts subluxing, and that's the clicking or popping that people can get. And if you think if you've got a forward head posture and I'm at the computer or I'm driving, the joint of the jaw is already forward, and if I'm chewing, eating in that same position, again, that disc gets wore out and becomes subluxation. So some of the things that we can do for treatment of the TMJ is, again, addressing your posture. So a couple things that you can do is getting your shoulders and head in a better position. If you think of a plumb line coming straight down through my ear, shoulder, and hip, that's the ideal position. So we don't want to have that rounded back, rounded shoulders, and forward head while we're doing things. So if we throw the shoulders up, back, and down, kind of in a box position, open up that chest. Those chest muscles might be tight as well because you've been in that posture. And then you want to do some chin tucks. All you're going to do is make yourself long and tall and tuck that chin. Again, doing about 10 repetitions, and again, go back at your workstation. Again, over time, an hour or two, you're going to find yourself kind of collapsing again. You want to just remind yourself or even put a timer on your computer every hour to get in and doing that exercise. Another muscle in the neck, your upper trap, your levator scapula, your scalenes, all these muscles in the neck can get tight because of that postural position, which can throw that jaw forward. Position, once you get into that good box position, you can hold on to the chair with one hand, opposite hand over the head, and you're going to side bend till you feel a light, gentle stretch in the neck, and holding on to that for about 20 seconds. And then you can fine tune the chin down to the right armpit or up to the left to find where your tightest spot is and to stretch that for another 20 to 30 seconds. This is a good one to do in the shower in the morning or take breaks at your workstation. Some other things that you should be aware of, again, we talked about maybe stretching your pec muscles or starting to strengthen between your shoulder blades by doing some type of strength training at the gym, at home, just to kind of have some good carryover. Otherwise, you're just going to get into a bad, painful cycle. So if you got questions or comments, please write them down below. Thanks again for joining us for Lunch and Learn. Hope to see you again next week.